Smith.
Thank you very much, Chair Sanders, and thanks to all of you for being here today. I've been listening to this conversation, and I'm really struck as I think about what this sounds like at home in Minnesota, because at home in Minnesota, I can tell you that child care access and affordability is a huge issue, and it's not just an issue in the blue parts of the state, it's an issue everywhere. And in fact, I think most Minnesotans don't really see this as a political issue at all. You know, in small towns and rural places, I hear from farmers and small business people and mayors and parents that childcare is just not working for them, and that's what we've all been talking about. I think there's, as Senator Kaine said, there's understanding of that issue. I think the question is, what do we do about it? And I want to just focus in first on what we have done about it, because I want to dispel any myths that might exist about whether or not in the work that Congress did, Congress took action to shore up the child care system because it was collapsing. If we hadn't done that, my understanding from talking to people in Minnesota is that this teetering on the edge of a cliff child care system would be off the cliff, and it would be in a much different situation. That's what I'm hearing at home. Just to give you an example, 96% of child care providers in Minnesota said that receiving the grant was helpful in keeping their program open and operating. 81% of people said that that was very helpful. Majority said that that helped them to retain staff. So it made a difference. It made a real difference. 8,000 child care providers were able to keep their businesses afloat. And I can tell you, I think this is probably pretty similar around the country. In rural parts of the state, that is more often than not family child care providers who are most at risk of having to close up because of the situation. So let me just go first to you, Ms. Brodinsky, talking about what you've seen in New Mexico. Your home state has been very effective in utilizing the child care stabilization grants. And could you just talk a bit more about how you, how you were able to use those dollars to shore up the system and position New Mexico providers and families for a better system?
Thank you, Senator Smith. We put together a formula that made sure that we based it on license capacity, but we also wanted to incentivize infant toddler care and higher quality care and give more to centers and family child care homes located in what we call high vulnerability index communities. So we acted quickly with that. We similarly, as a state, we called every provider to make sure they knew about the opportunity, and we thought that was very important, especially in our rural communities. Broadband access is very limited, so we knew that phone calls, text messages were going to be critical. And I feel good that we reached almost all of our providers. We directly talked to them, and they knew that the money was available.
And you said also in your testimony that flexibility was so important, because if you agree, as I do, that one size does not fit all, that means that individual providers are going to have different needs. A small family provider in the midst of that pandemic needed to make some physical improvements to their space so that they were able to stay open, right? The ability for individuals to be able to make their own decisions without the federal government saying, you must do this.
That's exactly right. They were able to make choices about how they spent it with a list. Most people did invest in salaries, but they did things like improve their outdoor learning environments. They made things more safe and healthy. They put filters in their houses or in their child care centers. So overall, again, they were much stronger by the end of the stabilization.
And that continues to reap benefits even though the fundamental market failure, I mean, I would say we have a market failure here. There's, the supply and the demand, how much it costs and how much people are able to pay is completely mismatched. And those are essentially the problems that we are working to solve, that Senator Murray and I and others and Senator Warren and I have been working to try to resolve. Not by saying you must have a child care system that is exactly this way, but by actually putting power in the hands of parents to make decisions about what that looks like. Ms. I'm about to run out of time, so I'm going to switch gears because I want to ask Ms. Moorman something that I think is really important for the committee to have on our minds. This actually isn't part of the jurisdiction of this committee, Senator Sanders, but it's really important. During the pandemic, the Department of Agriculture issued a waiver that allowed us to extend flexibility to provide through the Child and Adult Care Food Program. So home-based providers could be reimbursed for the food that they provided in their system. Ms. Moorman, could you just I know you're a home-based provider. Could you talk briefly, and that program is going to expire if we don't take action. Could you talk just briefly about what your experiences were with that program and whether you think that there's things we should keep in mind as we look at whether it can be extended?
Yes, ma'am. I participated in the child and adult care food program,
Right.
which is an important program and source of funding for child care community. However, major reforms are needed. Depending on where family child care educators live or their own income, we are assigned to a tier 1 or tier 2. In tier 2, the already modest partial reimbursement rate is about half of the rate for tier 1. Tiering only applies to family child care. It does not apply to centers or Head Start programs. In the 20 years since tiering was introduced, the number of family child care homes participating in the CACFP has decreased by 46%. Thanks to congressional leadership when the pandemic struck, the USDA had the flexibility to temporarily move all family child care programs to a tier 1. We also received an additional 10 cents per meal or snack reimbursement. This was a lifeline, as meals and child care programs are vital sources of nutrition for children. Children in my program for 10 to 14 hours per day, and I serve 2 meals and 1 snack and a dinner for children who stay longer. I share your concern about the end of the waiver, which expires June 30th. The cost of food has increased significantly. The CACFP reimbursement only partially covers the cost of food, leaving us to regularly pay out of pocket to feed children.
Thank you, Ms. Mormon. I know I've gone over time. I appreciated you bringing our attention to that. Thank you, Mr. Chair.
And I'm sorry to always have to interrupt you, but it's their fault.
It was my fault. I asked a question that I knew was going to take more than 8 seconds.
Senator Cassidy.
I defer to Senator Budd.